Hello everyone, welcome back to my channel. If you're living in Dubai or anywhere in the UAE, this video is a must watch. Starting January 1st, 2025, health insurance is now mandatory in all 7 Emirates. That's right, big changes are here. I am breaking it down for you. So what's changed? From now on, every private company and household sponsor in the UAE must provide health insurance for their employees, even in the place like Sharjah, Azman, Ras Al Khaimah, and Fujairah, where it was not enforced before. The government is very serious about this. No insurance, you could face fines starting from AED 300 a month, all the way up to half a million dirhams if you keep ignoring the rules. Let's talk coverage. Basic plan starts around AED 320 per year. For people aged 1 to 64, it includes emergency care, hospital stays with a 20% copay, and doctor visits where you pay 25%, but no more than AED 100 per visit. Follow ups within a week. Free medicines, you pay 30% of the cost, with a cap at AED 100 or 1,500 per year. It's affordable, but be aware basic means limited. Each Emirates has its own system. In Abu Dhabi, companies must also insure family members, one spouse, and up to 3 children. They also have the TICA program for UAE citizens, offering full medical coverage. Dubai, on the other hand, runs the under Inaya program for government workers and citizens. Private employees are usually covered under the Essential Benefits Plan with AED 1,50,000 in annual coverage, including maternity, emergency, and specialist care. Ignoring the new rules, it's risky. Fines can double if repeated, license can be suspended, and companies might even face visa issues for staff. Employers take note, fines can go up to AED 10,000 and healthcare access could be blocked. Now let's talk about picking the right plan for you. Basic plans are cheap, AED 500 to 1,500 a year. Great for emergencies or simple care. Comprehensive plans range from AED 10,000 to 20,000. These cover everything from specialist to dental and eye care. Think long term. Cheaper plans can cost more out of pocket later. You also need to check this hospital network, what includes or what exclude. Copay limits, whether pre-existing conditions are covered. Some plans have waiting periods, but others, like the health insurance scheme, cover chronic illness right away. And here's the tip: look at the claim settlement ratio. For CSR, a higher CSR means your claim are more likely to be paid out smoothly. Health insurance in Dubai and all of UAE is no longer optional. Whether you are an employee or freelancer, getting covered it's your responsibility in 2025. Compare plans, understand what you're paying for, and choose what fits your health and your wallet. If you found this video helpful, don't forget to like and share and subscribe. Thanks for watching, and I'll see you in the next one.